Hi, Dr. Desmond White, gastroenterologist. I want to respond to one question that someone asked on my YouTube channel, Dr. Desmond White. So the question is like that. My mother, 67 years old, has been bleeding for the last 6 days, severally. Doctors say we need to wait more for the bleeding to stop on its own. Do you also think we should change the hospital? So I suppose the person asked, a 67-year-old lady had bleeding, I suppose in the lower digestive tract, because she asked it in my post on the digestive bleeding. So what to do? So we actually follow guideline. Sometimes we have Singapore Ministry of Health issue guideline. Sometimes we follow the American guideline. So the American College of Gastroenterology actually had a set of guidelines for that. And the guidelines are very, very simple, okay? When you have a severe digestive tract, lower digestive tract bleeding, that means having fresh blood or having maroon blood in the stools, the first thing we do is what we call resuscitation. Make sure the blood pressure is okay, give intravenous fluid, check the blood count. If blood count is low, give blood. If they're on antiplatelet agent or anticoagulant that predispose them to bleeding, talk to the patient, stop it for a short while, and then plan for the next scope. It is often a difficult decision to decide when to scope. Obviously, when the patient is unstable, low blood pressure, high fast rate, we put them to sleep and we do a scope. We may even plunge the blood pressure. But on the other hand, if they're actively bleeding and we don't do the scope to stop the bleeding, they may just exsanguinate to death. So we want to resuscitate them enough to make sure that the blood pressure is okay, the heart rate is okay, they have enough blood, stable enough to be sedated so that we can do the scope. But yet, we don't want to wait for too long until they bleed non-stop and then they just bleed to death. When to do the scope to stop the bleeding, or should we stabilize longer and do the scope a bit later, or should we just stabilize and do the scope early? There's no firm answer. Even the American College of Gastroenterology guidelines says stabilize first, transfuse if necessary, stop anticoagulant, antiplatelet for a short while if necessary, if possible. Patients understand the risk and the benefit of that, and do the scope after a complete bowel prep. Do the scope early, but no need to be urgently most of the time. So to answer back this question to this inquirer, my mother had bleeding, lower digestive bleeding. Should we wait or should we scope? The standard answer is stabilize first, make sure blood pressure is okay, heart rate is okay, the hemoglobin is stabilized, and then do the scope early. How early? I suppose you need to discuss with the doctor. I hope it helped, Dr. Desmond White.